There are more than 10,000 chemical additives in American foods. Yellow 5, yellow 6, red 40, blue 2, titanium dioxide, more titanium dioxide. All of these chemicals are banned in other countries. Both consumer groups and political leaders have expressed concerns about this.
We have a major crisis. We are losing lives.
And it's the newest Health and Human Services Secretary who can make the biggest changes in policy.
Our changing food supply, the switch to highly chemical intensive processed foods.
But if you're wondering how these ingredients made it into our food in the first place, it comes down to one thing: an FDA loophole. The FDA was created in 1906 to protect public health and to ensure the safety of foods and other consumer products.
These laws stipulate that the label must tell the truth about the product.
However, over the years, they faced criticism for poor resourcing, slow recalls, and insufficient pressure on the food industry. Today, 73% of the U.S. food supply is considered ultra-processed. Additives are commonly found in processed foods, some of which are linked to reproductive and behavioral problems, cancer, and obesity, all major issues here in the South. The European Union has about 96% less additives in their food. There have been small steps forward, like the recent ban of red dye number 3, which was linked to cancer in animals. But red 3 was banned in most European products over 30 years ago. One of the main reasons why these mystery chemicals keep showing up in our food is the FDA's GRAS policy, which stands for Generally Recognized as Safe. This was created in 1958 so that companies could waive FDA review for time-tested products like vinegar, baking soda, or spices. However, in 1997, the FDA loosened the protocol to save resources, and now companies can self-declare the safety of newer, less tested chemicals without agency oversight. So new substances have been added to our food that have never been independently tested for safety, and almost half of additives now fall under the GRAS category. The agency says that making changes is complicated.
We have an industry that if you tried to change it overnight, there are farmers all over the United States who would not be able to grow the crops they're currently growing. So there needs to be a plan, and it needs to be implemented in a mature, thoughtful way.
But the FDA has a reputation of being slow. For example, it took 8 years for calorie counts to be posted on chain restaurant menus. And while the FDA recently created a chemical safety office, Jim Jones, the head of the FDA Food Division, just stepped down due to department cuts and disagreements with the Trump administration. Jones led the agency in its ban of red dye number 3, and he's known for his chemical safety expertise. An FDA official did tell us that they'll work with the new Health and Human Services leadership to evaluate chemicals in the food supply. However, no specific plans were provided. There's still uncertainty about the agency's future, but in the meantime, it might be good to pay closer attention to the labels on your food.